ARUS C, a system to optimize antibiotic use. How do we use ARUS C to manage diabetic foot infections? A 64-year-old male diabetic patient was admitted for a right diabetic foot infection and IV piperacillin tazobactam was ordered. ARUS C was auto-triggered. Does all diabetic foot infections require anti-pseudomonal antibiotics? The 2012 IDSA guidelines recommends that empiric therapy for Pseudomonas aeruginosa is not always necessary, but in severe infection, broad-spectrum empiric therapy is recommended. The majority of mild and moderate diabetic foot infections can be treated with aerobic gram-positive cocci-active agents. In countries with warm climates, gram-negative organisms including Pseudomonas are more prevalent. Anaerobic organisms are isolated in chronic, previously treated or severe infections. In developed countries, Pseudomonas is isolated in less than 10% of wounds, and a study in Malaysia reported a rate of 14%. It is also commonly reported as a non-pathogenic colonizer when isolated from wounds. Empiric anti-pseudomonal therapy is advised in patients who have been soaking their feet, who have failed therapy with non-pseudomonal agents, or who have severe infections. Taking into account the risk and benefits of anti-pseudomonal broad-spectrum antibiotics, TTSH guidelines recommends cefazolin and metronidazole for diabetic foot infections. In patients with severe illness, piperacillin tazobactam is recommended. ARUS C differentiates disease severity when prescribers enter the following factors of the validated pit bacteremia score. If the score is severe, piperacillin tazobactam is recommended. It alerts for prior MRSA, ESBL and carbapenem-resistant organisms and provides suggestions. ARUS C provides recommendations on investigations. Microbiology cultures guide further definitive therapy. Each set of blood cultures consists of one aerobic bottle and one anaerobic bottle. The yield increases with the number of sets of blood cultures collected. At least 2 sets are needed. ARUS C also provides further treatment clues such as evaluation of glycemic control, vascular supply and neuropathy, which is important in diabetic foot infection management. ARUS C adjusts for penicillin allergies automatically from CMIS. Do not click yes if patients do not have severe penicillin allergies with the following manifestations. In a patient who had rash due to amoxicillin reported in CMIS, ARUS C will adjust therapy accordingly. In patients with manifestations of severe penicillin allergies. For patient safety, ARUS C is not equipped to recommend therapy in these cases. Please consult allergist and infectious disease specialist. In a patient with rash to penicillin and worsened after 3 days of cefazolin metronidazole, ARUS C will suggest cefepime and metronidazole, broadening the pseudomonal coverage, avoiding piperacillin tazobactam.
Thank you for watching. Please go to the Google form to answer some questions and stand to win attractive prizes. Antibiotics save it from extinction.
Created using Powtoon.